Hi, my name is Dr. Mugisha Kyaruzi. I'm a cardiovascular surgeon specialist working at the University Hospital and private institution. And today I would like to talk about the techniques of cardiac surgery, which includes open heart surgery and minimally invasive cardiac surgery. In open heart surgery or minimally invasive cardiac surgery, most of our surgeries we stop the heart and we acquire the less blood filled with the static heart, the heart which is not beating, uh, to be able to perform this type of surgeries. And before we stop the heart, we have to connect this heart to the heart-lung machine, whereby the heart-lung machine acts as the heart by pumping the blood to different parts of the body and receiving the blood from the body. And also we close the lungs so that these lungs are addressed during open heart surgery. The techniques we use in minimal invasive cardiac surgery includes a direct vision, whereby we don't use any other tool to perform these type of surgeries. Instead, we perform small incision, a little bit big incision, about 5 to 7 centimeter, and we use the retractor to reach the heart, and we put the stage sutures after opening the pericardium, a very thick structure which is surrounding the heart, and suspend it, and we bring very much close to the thorax, and we are able to perform these type of surgeries through at least 5 to 7 centimeter with a direct vision, in which we use our own naked eye to perform this type of surgery. And this is known as a direct vision minimal invasive cardiac surgery. And also another way, where the other technique is endoscope assisted, whereby we use the scope, a tool, it may be the 2D scope or a 3D scope, to aid us to perform these type of surgeries. And the other third technique, which is more advanced, we perform a very, very small incision of about 2.5 centimeter or 1 inch, or 1 inch or 2-inch centimeter, and we use a 3D scope, and this is known as the total endoscope approach of performing minimally invasive cardiac surgery. In this total endoscope approach of minimally invasive cardiac surgery, the incisions are much more smaller, and we don't use any type of rib spread retractors. We only use the soft tissue retractor, and we use the very magnified scope, a 3D scope, to reach the heart and be able to perform the procedures of either valve surgery or coronary artery bypass grafting. Most of these surgeries are with the total endoscope, includes the valve surgeries, which includes the mitral valve repair and replacement, aortic valve replacement, tricuspid valve repair and replacement. But also we remove the tumors from the heart through this total endoscope approach of minimal invasive cardiac surgery. The other fourth approach of minimal invasive cardiac surgery, which is using the robotic assisted approach, whereby we use the robot as the tool to perform this type of surgeries. The technologies that we use in minimal invasive surgeries, as I have explained before, includes the robotic approach and also using the endoscopic approach. And through these type of surgeries, we use very long shaft instruments, and which are thin. Then they are able to pass through the thorax and reach the heart and be able to perform these type of surgeries. The minimal invasive cardiac surgery is a way to go in cardiac surgery. It is the future of cardiac surgery because it minimizes the trauma that is, maybe due to opening the sternum, and patients might require to stay in a hospital a very long time. But with minimal invasive cardiac surgery, the patients recover much more quickly. They experience less pain after the operation, and they do experience less blood loss after the operation, and also the risk of infection, because the incision is very small, is much more smaller compared to open heart surgery. But also these patients, they do experience very relaxed post-operative physiotherapy approach of the lungs, whereby they are able to perform the physiotherapy of the lungs very much comfortable compared to the patient with the open heart surgery. And also, these patients, they are returned to their normal life activities in a very, very quick period, especially those patients who perform very heavy jobs like the drivers, and probably the patients who work in industries whereby they are required to carry very heavy weight. So these patients, because the sternum is not broken down, they recover much, much more quickly, and they are able to return to their jobs in a very, very short period of time. In early stages of performing minimal invasive cardiac surgery, the patient, the bypass time, the time of performing the whole operation might take a very, very long time, like around 4 to 6 hours in minimal invasive cardiac surgery, compared to a well-trained surgeon performing a traditional surgery, which sometimes it take less than 3 hours, or between 3 to 4 hours. Minimal invasive cardiac surgery is a little bit longer because the preparation of these surgeries is very, very long sometimes, because there are meticulous procedures which are to be taken in the operation, which include anesthesia, inserting the different lines to the patients, giving position to the patient, and also the instruments which are used during the operation, they have to be inserted through different place, which includes performing the peripheral cannulation for connecting the patient to heart-lung machine to do this minimally invasive cardiac surgery.